Hi, it's Tracy, CEO of My Practice, My Business, and I get to take over the podcast and YouTube video. Normally, it's Dr. Rob, president of My Practice, My Business, who gets to start this whole thing, but this is where it's my baby. We're going to talk a little bit about Delta Dental and their article that I came across recently talking about how high out-of-network reimbursement could be hurting your employees.
We began our presentation right there.
So Rob, I really wanted to talk about this article in question because I was, of course, going through all sorts of fun things that get sent to us throughout the nation from different dental offices. And there was an article that was given to me from mainly Delta Dental, the entire entity throughout the nation, geared towards employees and telling the employer groups, what they can do to help their employees with their insurance. And their focus really here is encouraging HR groups to tell their employees to start seeing in-network providers. Now, Delta's really pushing this because offices in certain states are deciding enough is enough and they're dropping Delta Dental. And the premise was always, well, I can see you as an out-of-network provider. I even will honor your lower fee. But Delta actually was known to pay the same, if not more, for reimbursing out-of-network providers. And so it worked really well for the patients. The providers were still able to keep the patients, but Delta wasn't too happy about this because what's the value of seeing an out-of-network provider to the patient at this point? They get reimbursed, the patient's paying less out of pocket, and the doctor's getting paid more from Delta, so it's hitting their bottom line.
Let me just emphasize, the doctor's being paid more, or I want to state, being paid more fairly. For the services we provide. This is so important. When we dive into our advanced dental business training at My Practice, My Business, we dive into what's known as direct operating costs per hour to run your practice, and then we take and hone in on the procedures that you do and the codes you're able to charge, and that aha moment that every single dentist has of traditional billing is like, I'm not even profitable on this plan. I'm not profitable on this plan. I'm not profitable. I mean, it just goes on. And then they look at their fee-for-service fees and they're like, I'm not even profitable on some of my fee-for-service fees on these, and we get those fees based upon surveys. So this whole thing about Delta, when you sent me that article and I read it, and
you should have heard the words coming out of his mouth.
I was like, I don't even want to talk about this because I'll probably outline some adjectives, and we don't really, we shoot these. They are unedited almost all the time because I want you to know how I really feel. But this is Tracy's wheelhouse. I'm just going to augment some of the things that she's saying, but in the state of Washington.
That was my next point. This is where it gets interesting because that was the premise of what these offices were doing, and Washington would be a great example. Well, Delta Dental of Washington decided to punish the patients for seeing out-of-network providers. And as a result...
Wait, they thought they were punishing the dentist for being an out-of-network provider.
They're punishing the patients. And so this is where it got really frustrating to me because when Delta Dental retaliates against a patient for seeing an out-of-network provider, what they did is they drastically reduced their percentage in order to encourage the patient to go back to see an in-network provider. And I'm talking like a drop of like 40% plus for reimbursements. And that's where I got really frustrated seeing this article because it's all geared towards telling patient or HR groups, you want to protect your employees from being taken advantage of.
And the thing, Washington had the premise correct, in our opinion, going after them for, that in-network system. But come to think about it though, honey, I'm thinking back, did they ever really fix it?
I don't think they did. Well, and that's where somebody needs to...
They did create the bundling law, but their bundling law did not put the financial obligation back on the patient where it belongs, in our opinion.
They put it back to Delta.
They put it back to Delta.
And it sounds like Delta, unless somebody tells me otherwise, it sounds like Delta will be reacting by increasing premiums to the patients.
Yeah, so either way the patient pays. Why not take Delta out of the equation? Why not take all the insurances? Delta Dental of 15 states, California, Utah, Texas,
and now 16.
And 12 more, and soon to be 16 with Idaho in the loop now. Their leadership actually understanding now that dentists are not profitable based upon their reimbursement rates. What a concept. And that higher end dentistry costs more, and that it should be the patient's choice between LEPAT and MEPAT services, not the insurance company.
Well, and I want to reach out, and if somebody in the state of Washington that has the knowledge reaches out to us and lets us know, because the last time I looked at the law, I want to say it was around June or July.
Right.
I didn't see anything that addressed the issue at hand, which was,
out-of-network providers.
Delta still going to be reducing their percentages for out-of-network providers? And so that's something we do need to look into.
Something clicked in my brain just now. It works once in a while. I think Delta might have just retracted without there being legislation.
That might have been the case.
And if they did, good for them.
Yeah.
But we're not big fans of Delta Dental of Washington for many reasons, but and we're not big fans of the Washington State Dental Association either. We love the dentists that we serve. Yeah, they know it exactly. But here's the thing that we hope that they're changing their ways. Mm-hmm. We hope that the state association is representing their constituents. And we hope that they're holding the insurance companies responsible for policies that are not in favor of the doctor-patient. Anyway,
okay, so let's take off with this article here, and I'm gonna grab certain sections and read them to you and kind of give you our take on these things. So the recent article warns employees that high out-of-network reimbursement may harm employees. On the surface, it sounds really protective, but in reality, it's a defense tactic of the Delta Dental business model, and it's one that prioritizes minimizing payouts over patient choice and the provider expertise. So we're going to go a little bit into detail there on your point earlier today, LEPAT versus MEPAT. So Delta Dental reimburses in their policy off of the least expensive professionally accepted treatment, and we call it LEPAT.
Not hamburger. They reimburse at hamburger, not filet.
Yeah,
they reimburse at regular gasoline, not premium gasoline.
Walmart, not Nordstrom's, right? Nordstrom's.
We shop at Walmart.
I know, it's true. So this means patients are only covered for the cheapest, minimally acceptable care. So dentists, however, frequently recommended the more expensive professionally accepted treatment. And because we want to give those values, those MEPAT services, those options to those patients, these procedures and materials will last longer, maybe look better, support better oral health outcomes. And the problem is the gap between what Delta Dental pays, which is the LEPAT, and what the patients deserve to choose, which is the MEPAT, is the reason why patients face higher out-of-pocket costs, not just because we're overcharging. There is a definite difference between the two. And you'll notice in another podcast how we talk about the American Dental Association, what they say about offering those types of enhancements and how it is absolutely something that should be the patient's choice. So most dentists already provide the patients with multiple care plans. And so if I were a fee-for-service patient, the patient comes in and financially has an issue, then there's going to be structured plans that are kind of catered and structured to fit their budget while still being even better than the LEPAT services that are reimbursed by these insurance companies.
So you're saying not the $250 crown, but maybe the $75 crown.
Yeah, absolutely.
Yeah, exactly.
Versus the $50 crown.
Yeah.
And so patients can choose a more affordable route or invest in long care solutions. But either way, that level of care is absolutely higher than Delta's LEPAT standard. So by reimbursing only for the cheapest path, Delta erodes patient choice. The company frames this as a protection, but it's really cost shifting. It's forcing patients to pay the difference while Delta profits over the low reimbursements. So that's kind of a concept of, what they do.
Not all Delta plans are that way. Some Delta plans have upgrade policies in their contracts, and we praise them for doing that. Good for you, Delta, of the 16 states. The rest of you, not so sure.
So in the article, Delta argues that in-network participation ensures quality because they have credential checks and audits. Now, this is where I have frustrating thoughts because it's misleading.
When have we ever been audited on quality?
Yeah, well, and that's the thing. We're already licensed, regulated by state boards, subject to strict infection control and continuing education requirements. So suggesting that non-Delta dental dentists are less qualified is false, and it's really offensive.
Seriously.
Delta's quality measures are less about the patient's safety and more about enforcing compliance with the restrictive cost-cutting contracts. Delta's policy forces dentists to purchase the cheapest labs, cheapest supplies, lab restorations, technologies, medications, if they even give the medication.
Everybody in the industry knows it's a race to the bottom with PPO plans.
And
we don't teach that. We teach choice and how to charge for it.
But if you're an a doctor who takes an in-network insurance company and you decide to go and network with them, and you know that you're getting reimbursed for the least expensive way of doing the procedure, you're going to find things and you're going to beat up your sales rep to get cheaper things. Now, you might maybe do a better composite, but you end up cost shifting by not getting the better products that are needed to complete that service. And so it gets really frustrating to see that happen, but it's something that we see all the time. And I don't blame them.
I was just on one of the social media networking groups just the other day, and they were talking about composite material and bonding agents. And I could not believe how many dentists were teaching each other where to buy the cheapest composites, the cheapest bonding agents that still pretty much did the job, but they weren't as good as the higher end nano composites or the higher end bonding agents.
Well, and I don't blame them based on the reimbursement rates. You need to figure out ways.
They don't know about the contracts like what we train on. If you don't know what you don't know, I would be doing the same if I didn't know.
And if they feel that they're not able to offer those choices, then it doesn't make good business sense to give it away.
Exactly.
So it makes sense to me why they're doing it, but is it right? And is it right for the patients? Because the patient has a filling, it lasts 2 to 5 years, which is what the insurance companies will allow it to be replaced at. And the patient does not blame the insurance company.
Well,
the patient blames the doctor.
I know, exactly.
For doing inferior products. And so even in the contract with your insurance companies, most of them will say, for the ones that I've seen, will state that the insurance company is not liable. They can't be held financially. They can't be sued if the patient's unhappy with their results. But the doctor's in a position where he or she has to do what they're told.
Trace, they sit there. We sat with that CEO of that one insurance company, and he's like, the CDT codes include LEPAT or MEPAT.
Oh,
Doctor, it's your decision what you put in. We don't tell you what to put in, but that's your decision. No, financially, you are forcing me to put in LEPAT services, the least expensive products and technology materials, because of the reimbursement that you're giving me. I can't afford to put in the higher end stuff, so don't give me that crap, CEO.
A doctor, let's say, insists on doing it. Let's say there's a doctor who decides,
altruistic doctor.
I'm going to do the best of everything. Well, first of all, the only way that you're going to possibly make ends meet is if you cram your schedule, which means you're going super fast through those procedures. You're overworking your team members.
Quadruple the hygiene department.
Yeah.
One hygienist can see 5 patients a day. I know they can.
So from a business perspective, either you...
Come on, that was funny.
Yeah, it is kind of funny.
If you think about it.
Okay. So you can see how this just doesn't quite work, right? It just doesn't. We want to make sure that there's a LEPAT versus MEPAT deal happening. And going back here, out-of-network providers or in-network providers who are unrestricted by dental plans and offering choice to their patients are financially free to offer both the LEPAT and the MEPAT services to their patients. And that's the whole thing. I can give patients choice, and I love that. And I'm here to serve them in what they want.
Higher level of care.
This absolutely higher than any other dental plan that controls the procedural costs and restricting patient choice when it comes to their oral health care. Now, Delta minimizing payouts. In the article, it warns about balance billing.
I hate that term.
And higher costs for out-of-network care.
I hate that they have defined balance billing.
So balance billing is when you have your full fee-for-service fee And let's say when you are in network, you are
you have a contracted fee.
Your full fee is 100, your contracted fee is 75, and you charge the
50,
patient
more like 50.
Yeah, it's more like 40.
30.
But you charge the patient the difference in order to make up that difference and go up to your full fee. That's something
balanced billing.
You can do it.
That's against the contract.
Now, balanced billing doesn't work that way with fee-for-service providers. Either way, you have a fee. You don't agree to a lower fee with the insurance companies. But what's interesting is, again, on my earlier point, most insurance companies have higher out-of-network payouts. So if I kept my full fee, insurance pays more money towards that service. Patients usually end up paying the same, if not less,
and
with that type of service.
And what Delta Dental Washington did is they took and lowered the percentage that they paid on their fee-for-service fee down below what the allowable contractual amount is for in-network providers.
It was terrible.
That is like, again, the ethics of that company are, and what they get away with are unbelievable. But I digress.
So again, the article really focuses on how these mean dentists are doing this horrible thing and calling it balanced billing, but they're not talking about their own issues with reimbursing. So some of the things that they do, bundling, right? That's an easy one there. It's when you take two distinct CDT codes and combine them so that you don't have to pay for both of those, even though you tell the provider or both the provider and the employer group that they're covered. Misleading. How about misleading EOB language? When they say that, no, they don't say something's not covered. They say, oh, we think that should be included. Well, the question is it covered? Of course they're not going to want to admit that a service is not covered. It makes them look bad.
Makes them look bad. And so they're the hero. We're the villain.
Yeah, and so if the office doesn't initially collect for that non-covered service from the patient, now the EOB says it should be written off, even though it's not covered. Good luck, office, with collecting, because it does. It manipulates the patient into thinking that these offices are collecting for services they shouldn't. Some of the things that we're noticing, AI. You want to talk about that one?
Well, I don't want to mention a certain AI company that partnered with a certain insurance company, of which that AI company people that are finding out have eliminated their market share with being able to sell AI to dentists when you are, quote unquote, in bed with the enemy.
Can we not say the name of that AI?
Well, I think people know who it is, but, all right. But they use that automated system to reject claims without any adequate clinical review. They're just using the AI only. And we use an AI company, and we can say Pearl. We love Pearl. And Pearl has, even with AI though, when you look at Pearl, it's an adjunct, it's not a wherewithal. Because you'll get false positives, but Pearl also is good in helping us at least look at stuff that we normally would probably pass over.
Well, and
that's what I've noticed. So I love Pearl.
Yeah, and that's something that we're going to see more and more is these AI claim denials where insurance companies don't even have a person looking at the claim.
No.
The x-rays, nothing. And so that's a tactic right there. What about out-of-state loopholes? That's something that we are definitely addressing.
We're addressing in legislation this year.
So if you're a provider and you are in the state of Utah, you're required to follow Utah state law, right?
I have to follow Utah state law when I provide care to a patient.
Washington state law?
No, I don't follow any other state law. I follow Utah state law as a licensed provider in the state of Utah.
Now, what about this? If you choose to practice in the state of Washington as well,
I have to take, there's no reciprocity across states. I know they're trying to have these compacts, and the compacts are questionable, but I still have to license myself in another state.
Which means you have to know the laws there, correct?
I have to know the laws. I have to know what their division of occupational professional licensing allow and don't allow.
Perfect. So the out-of-state loophole with these insurance companies is if they're written in the state of Washington and the patient is treated here in the state of Utah, the insurance companies are allowed to say they don't care about the stupid Utah laws that were passed.
Because it was written in another state.
Because it was written in another state. And that's a huge one, because why have a law if you can't enforce it?
And what if there was a way to get around that stupid loophole in legislative law.
We will talk about that when
but
it's
that's
done.
Another topic,
wink, wink.
And hopefully we will have that this year.
So this is where, again, Delta's talking about how unethical billing out-of-network providers are. It's not true, especially when they're not discussing those things, because these tactics reduce Delta's financial responsibility while shifting costs onto patients and providers.
And to me.
And to you.
Yeah.
So the bigger picture here, Delta frames in-network utilization as the only way to keep costs down. If you're in network, then it'll be cheaper for you, employer. But what this really guarantees is that Delta can be more predictable with their profit margins. It's not better for patients.
No.
At all. So dentists who leave Delta networks do so because the reimbursement levels are just so unsustainable that they can't run their business, and it compromises the quality of care. So the truth is simple. Staying in network with Delta means settling for least expensive care.
For those Delta contracts that do not have
particular
value
contracts
added clauses in their written contracts, which grateful that in the state of Utah, our Delta does, but other Deltas and a couple of the other fringe insurance companies do not. Is that fair to say?
Correct. And patients need to know about this. And this is where, again, it gets us very frustrated because we're not talking truth. So, as I said, staying in network means settling for the least expensive care for certain Delta dental providers. Going out of network may cost more upfront, but it allows the providers to deliver treatment that really genuinely helps the patient and serves their health.
Exactly.
So, employers, I want you to really ask yourself whether Delta Dental's model really benefits the employees.
Delta Dental or any other insurance
well, in this
third-party
case,
payer,
it's just the article,
I know the article's from Delta, but this applies to everybody.
Yeah. But the other question is, does this really protect the insurance company's bottom line by making these statements? And patients, I want you to remember that you have the right to choose the care that goes beyond the cheapest acceptable option. Other plans do exist. There are a lot of plans that don't dictate treatment through that restrictive verbiage in their contracts and definitions of what's acceptable.
Exactly.
Patients deserve choice, and the dentists deserve the freedoms to practice without the intervention from these cost-controlling mechanisms that are disguised as safety and quality safeguards. So please, look at these and think to yourself, what is the insurance company's motive behind posting these types of articles and really targeting you as an employer group, especially leading up to open enrollment?
It's about market share.
It's all about market share. It's anything they can do to get the patients to be more dependent on them.
We dentists should care about the care and not the contracts.
Absolutely.
That should be it.
So any questions, please reach out to us. Any insights with new legislation happening to protect your practice, we would love to hear it. And remember, follow us on social media. I want to see new people on YouTube, on Facebook, on Instagram, our podcast. We have so many wonderful platforms for you to participate.
Thanks for watching. We hope you have a great day.